your anchorman, Dr. Jolo. It's a beautiful day. It's going to be a beautiful and interesting day for all of us here as we go into our next topic, which is called PMS. Well, to the petrol attendant, if you say PMS, he will look at it from another angle. If you think it's petrol, no, this is not petrol. We are talking about premenstrual syndrome. What is syndrome? Syndrome is defined as a group of diseases. A group of diseases. And when you say premenstrual, you are talking of what happens when the menstruation is about to start. Pre means before menstruation. Every woman experiences it. And you know, menstruation is a very important aspect of a womanhood. In some cultures, they look at it as a cultural thing, as a customary thing. They do certain things that some people believe are rituals. They kill chicken, they kill goats in order to celebrate the commencement of menstruation in women. So culturally, it is very important to some of our environments. Very, very important. Now, naturally, whatever has a beginning must have an end. A woman, when she starts menstruating, we always have it in mind that she will stop menstruating eventually. Premenstrual syndrome is similar to postmenopausal syndrome because the women experience certain complaints. They have certain complaints that they have when they're about to commence menstruation. Likewise, they have certain complaints when they're about to end menstruation. But presently, we are going to concern ourselves with premenstrual syndrome. What happens when a woman is about to start her menstruation? Normally, when the menstruation is about to start, it doesn't start regularly every month. It will start gradually. The first one will come, then the next one will come maybe 3 months later, then the next one will come 2 months before it becomes, depending on the woman, before it becomes every month. But then, in some women, because of the cyclical changes in their body, because of the hormonal changes in their body, they start experiencing so many symptoms that may be similar as if they are diseased, as if they have challenges with their health. But really, these are not challenges. These are issues. These are normal things that they have to go through because it affects their higher sense, their psychological status. And some of them, they will be moody. They have headache. They will be moody. They don't want to talk to you. They will be moody. They are hungry for no just reason. They will be moody. Some of them will be vomiting. Some of them will complain of body pains, joint pains. Some of them will say they can't sleep well. All this will come together to affect their mood. And when you are not aware, you may think, what's wrong with this lady? Why is she moody? Even the lady herself will look at herself and say, what's happening to me? I don't know what's happening. I don't know why I did that. Then if some of them that are reasonable will say, I hope I wasn't too rude to you that day, the way I spoke. Even the guy said, you are rude to her, you say she didn't know where she did it. And someone say, at least you should understand. You know I'm a woman, some things do happen. So as far as some of us will look at it, this is not a disease. It's part of growing up. It's part of responding to the what goes on within the body. And it is cyclical. Now, how do we manage premenstrual syndrome? The first thing is that we are aware that it exists. When we know that it exists, it's easier for us to know how to manage it. Now, if there is headache, if the headache is not too much, relax. Just take your mind off it. The headache will go. If there is abdominal pain, if the abdominal pain is not too much, relax. It will go. If there is something like nausea, if you feel like vomiting, some women vomit. If it's not severe, don't worry yourself. It will go. It's a cycle. Some women, when they experience, some of them, they find it difficult to eat. Some of them, they throw up, they vomit. Some of them, they are so moody that even when you crack a joke beside them, they won't appreciate it. They will think some of them are so paranoid, they feel that you are making fun of them. And they respond in such a way that you feel, why did this lady do such a thing to me? But what we are trying to say is that this is part of life. Let us be aware that it exists. It's part of life. Let us know how to go about it. Having spoken about the mild symptoms that get associated with premenstrual syndrome, let us now concentrate on the syndromes and how to manage the challenges that menstruating women will go, how to manage the challenge that menstruating women will experience when they have this syndrome. For some women, they they throw up so much that you think it's more than that. Some women, you may assume that they are just having what we call pre hyperemesis gravidarum. Hyperemesis gravidarum is when a woman is throwing up too much as a result of early pregnancy. Some women will have so much pain that they will start throwing up to the extent that observers may start suspecting that they are pregnant already. And the vomiting is because of the severe pain. And it is when they throw up, when they vomit very well, the pain will go down. And then the pain will come up again, and they will vomit. How do we manage this one? It is managed by the administration of what we call antiemetics. We manage it with some drugs that will prevent vomiting. Then we manage with some analgesics, because before they start vomiting, there is severe pain in their lower abdomen. So much so, if you are not experienced as a doctor, you may think that it's a surgical emergency. It is not a surgical emergency. But when you get the history from the woman and she tells you that she's just started menstruating, you will know what you are supposed to take. There are some drugs that you will need to use. For more information about this, I don't want to disclose the names of drugs for fear of some people abusing the drugs. Just go and consult your physician, who will tell you the drugs that you will use. Then in some cases, there will be severe headache. In some cases, there will be stooling. Those ones will be treated with symptomatically. When we say we are treating symptomatically, we use the medications. We will use the medications that will treat the headache, the stooling, and other symptoms that come with it. And ladies and gentlemen, I believe this talk that I've given you will help us how we manage our young ladies as they start menstruation. And another thing that I want you to know, premenstrual syndrome is not a disease. Premenstrual syndrome is not a disease, but it's a physiological response to the body. And as the time unfolds, the body will get used to this uncertainties. And as the body gets used to these uncertainties, with time, everything will normalize out. And ladies and gentlemen, don't be angry with a woman that is irritable when she's menstruating. With what I've said, I believe you have been well educated.
Ladies and gentlemen, don't be angry with a woman that is feeling irritable.
Yeah. Ladies and gentlemen, you shouldn't be angry, but understand the woman that is irritable because of what she is going through. Eventually, when she too looks back at her history, Sorry, sir. Ladies and gentlemen, is it that is irritable or feeling irritable? Irritable. Yeah.
Continue, sir. All right.
And eventually, when a woman looks at herself and what she has gone through, or what she went through before she started menstruating, she will smile and be able to give more knowledge to women that are coming to experience the same symptoms. Yeah. Ladies, my friends, I hope what I've said has been helpful in dealing with this premenstrual syndrome. And I know if you have any questions, feel free. I know just as you do that, you are free to contact us as you are seeing on the screen with your questions, and I'll be happily involved in answering them. I thank you very much for so far as we have done it. I really appreciate your feedback, and now we have been able to support each other in terms of communication as we used to do. If you have any questions, feel free. It is displayed on the screen in front of you. Feel free to talk to us, and I'm always there to answer you 24/7. Well, it's a beautiful day, and you know what we do traditionally. We have enjoyed ourselves intellectually. Let's go to the social level. Let's go to the other room. Enjoy some jazz, some African music. Feel free. But do not forget what we said before now, and be ready to pass the knowledge to the next person beside you. Thank you. Enjoy yourself. Cheers.